And a lot of people, the stigma of shaming and what will people think, makes them not come out to ask for the necessary resources that they need to help them navigate through the food insecurity. In the olden days, and some people still have, if in some society, they stigmatize those low income earners. Some people will say they are lazy. They are not lazy. They are right there in your backyard. They are right there in your corner. You only don't see them. A lot of them cannot speak for themselves because a lot of them feel ashamed. A lot of them feel stigmatized. A lot of them feel, how will they look at me? I don't want to look like a beggar, because they believe that's what they are to those people.
Hello, everyone. Welcome to another episode on Your Health is Your Greatest Wealth. And today I have the pleasure of introducing my good friend, Noel Habiba Allred. And Noel will be talking to us about food insecurities today. She is a social worker, and I just wanted to do a deep dive into what the landscape of the United States looks like right now with regards to food insecurities. So, with that, Noel, take it away.
Food insecurity has always been a problem, and the American society, Feed American, they've been really trying hard to try and bridge the gap. But with the rises price of goods, it's more difficult than we think or expect. And according to USDA statistic recently, we have 12.8%. That's 17.0 million households who are food insecure because they cannot afford to buy fresh food that they need for good health. And that creates a bunch of all other problems. And most of the time, a lot of people who are food insecure are not just the very low income people, even the middle class these days. We've seen the increase even with the middle class people who has one, two, some of them even three jobs, and mostly the single parents. For example, I have a family I've been working with, a lady with two kids, and she has two jobs, and she has a little 9-year-old kid who most of the time stay home by himself because the mom has to work, and he doesn't even get food to eat at home because they don't even make enough for that. So sometimes he gets some snacks from the library, and what kind of food will he get from the library? They are just full of carb. They are not healthy for him. He needs good food. He needs good nutrition that will help him, help his brain function well so that he can, become who he intends to become in the future. And a lot of people, the stigma of shaming and what will people think, makes them not come out to ask for the necessary resources that they need to help them navigate through the food insecurity. And another problem we have is that we don't have enough resource center to give those people education, to inform those people on what they need, on how to navigate the system. Because most of them, and most time, the people of color mostly are affected by this, the minority. They are the one most affected because they don't have the transportation to get to this resource center. They don't have the information, and they don't have the whereabout on how to go about this thing. So it's a bunch of economic factors that ties in together and makes it even more difficult for the low income families.
So, Noel, I actually met you when I was working with the university system with their nutrition department to educate individuals that did have food insecurities about better nutrition choices. So, what you said about the rising food crisis, can you talk a little bit about how a compromised financial situation affects the choices that families actually make with regards to nutrition? How does finances relate to that, and what is the impact on individuals' health?
Well, for people who don't have a good job, who cannot, who are the unemployment rate too is, it's getting high for low income earners because they don't have the skill. And because of that, they cannot afford a good job that'll help them sustain them and their families. And with that, they don't have food good choices. Some of them go get, they may go to the food bank to try and get some food, and it's whatever the food bank have, that's what they get to eat. If there's a food bank that has just, just pastries, that's all they can afford to give them, and that's what they have to eat. And then that's why I keep saying that we need more information, we need more education, we need to educate those people. And even the people, the social service workers, they need more education so that they can enlighten those people, because some of them cannot afford to continue their education. And so when you have a skilled social worker who could help those people, who knows the basic things, they can put together and let them know that, okay, you can mix this food, or if you cannot afford to buy fresh vegetables, there are some canned vegetable you can mix together to make a good meal, and that will help a little bit. It won't go a long way, but at least you get a little good meal to eat for a good brain function. But with the low salary they get, they cannot go to the store and say they want to go buy healthy food. So that equally, it affects their choice of food, because they don't have the money to go and say, oh, let me go to the grocery and buy some vegetables and have some salad, or have some vegetables in my food. If they get to the grocery store with all the price increase, and probably maybe they want to go and see if they could buy some salad and some tomatoes, and they get there, it's like how many dollar per pounds. Then the same money will buy a box of cereal or two boxes of cereal. Of course, they'll prefer to go get the two box of cereal that is filling, rather than go get just one tomatoes, because even the tomatoes, you cannot just eat the tomatoes and be filled. Even though it's healthy, you need to incorporate it with other ingredients to make a good meal.
I wanted to ask you about something that you mentioned. Okay, so you obviously work with food banks and you mentioned stigma and stigmatization. So, talk to me a little bit about that and why people that are in need may not seek out the resources even though they are aware of them. What goes into that entire stigmatization and how does that affect individuals needing the resources?
Well, in small communities, everybody knows each other. And in small community, the same families work together in businesses in or different organization. And that sometimes they feel so ashamed going to the food banks, because they're thinking, what will people say? That I cannot afford to feed my family. They think about what will people say, and what will people, how will people view me? That means I'm not a good parent. That means I'm not doing what I'm supposed to do. Because I think in the olden days, and some people still have, if in some society, they stigmatize those low income earners. Some people will say they are lazy. They are not lazy. It's just a situation, sometimes economical, or sometimes it's situational poverty happen to people, sometimes beyond their own control, because somebody, like for example, the family I was working with, a lady had a job and she was just being paid minimum wage of $15 per hour. She has two kids in high school. Her car got broke down. She had to fix the car. The son got sick. She had to pay some bills for it. So that alone has already made her depleted her the little money she has, and now she doesn't have money. But she's feeling so ashamed that when she goes to the food bank, people will think, you work and you make money. How come you still go to the food bank to collect money? People fail to understand that there are situations that could happen to other people, and it is okay. If somebody is you don't have sufficient food to eat, and you don't have the resources are there, it's okay to go to seek the help temporarily until you get back on your feet. But the society doesn't inform the people and give them the right education for them to know that it is okay. They just look down. They just feel like, oh, if I go there now, they'll think I'm homeless or I'm lazy. And nobody, with all the families I've worked with, there's no one person who likes to be sick. There's no one person who say, "Oh, I enjoy going to the food bank to get food." No, a lot of them, if they have the opportunity and have an alternative, they will rather avoid that, with the stigma. Because another thing is that, oh, okay, they are going homeless now, but with increasing household and with the increase of food prices, a lot of things doesn't add up together. And that's why we as agencies in these communities, we need to try and inform people, not just the workers, but even the media and the locals, even if we can just go around, talk to each other and let people know that it is okay if somebody is going seeking help, a resource to help them, pay their house rent or get some food to eat or get some good nutrition for their family. That's fine.
And Noel, I think what you also highlighted is very important to emphasize that a lot of the individuals that do seek help, they do have jobs. It's not because they're in the situation of their own doing. Many are single parents. And at the end of the day, it really is their children, if they have children, that really also suffer the consequences. I mean, there's been studies that when children don't get the right nutrition, they can't learn as well in school. They tend to have more health issues. That goes for the adults as well. So this is a compound problem that food insecurity affects the sense of stigma, which feeds into mental health. It affects nutrition. If you have compromised nutrition, it affects your physical health as well. And so I guess what I would like people to be aware is we really need to end the stigma, and we really need to help people where they're at. Many individuals did fall on hard times, like you mentioned. It could be a medical bill or a broken car, and just with all the food costs and the height in inflation these days, people are not able to meet their basic needs. I mean, that's really what it comes down to. We're not even talking about luxury items, but just basic living necessities: food, shelter, clothing. And that's really what we're talking about. That does seem to be the landscape of many households in the United States these days, and globally as well. But for the purpose of this conversation, we're talking about food insecurities in the United States. So how can we as a population educate those that are not facing food insecurities? How can we help destigmatize the whole notion of needing assistance?
I think we can help them by information, by most counted having a resource center where people can go get information. And even when people go for different programs, we have with the government is trying, though they have some different programs like welfare programs, like the housing program. But a lot of this low income earners, they don't even have that information. But if they have that information and they get to know that it is okay, for them to ask this thing in our communities, when we have our fairs in the county council meeting, people can talk, if they can, talk about this and just give out the information. And we need more the media to get involved, and all agencies and the government to get involved and let people know in their various community that these resources are there, and it is okay, to go seek the resources when you need it temporarily, mostly for those who are working hard, the low income, hard working, citizens of the state or the county. Then I think that would help a great deal. They need to be informed.
No, what I also wanted to bring up is I think wherever people are with their own political views, whether it should be government that steps in or not, that's not this conversation. We're just talking about basic human dignity. So whether it's the government that steps in, nonprofits, individuals, whoever the stakeholders are, it's really about solving a problem, which is food insecurity. And I just wanted to say that because I know sometimes government involvement is a political issue, and this is not an issue that should be politicized. It's hungry people that need food.
Sure.
And so
Mhm.
whether they're going to a food bank, to a nonprofit, to other resources, it just really is an issue that needs to be addressed. I know several communities do food drives during the holiday season. And another thing that people need to be aware of is that people with food insecurities aren't only hungry during the holidays. It is a year-round problem. And that also needs to have awareness that, as you're feeding your family, really think about how fortunate and blessed you are, because not everybody is in that situation. And to your point, I think a lot of parents internalize that stigma and have low self-esteem, limiting self-talk, feeling like they are not good providers for their family. And that also does not help individuals. So this is a compound problem. It affects so many aspects of individuals' lives and us as a community. As a whole, it is a community
Yep.
problem. I appreciate that you mentioned that so many different organizations, groups, individuals have to come together, because this is not an individual problem. It really is a societal problem. And we as a society do need to collaborate to find the solutions. So, to that point, Noel, what other types of services do you see people needing when they do come in for food insecurities? What else is lacking?
Oh, because they are all tied in together. That's why I said for somebody who is unemployed, and some maybe the low income family earner, somebody who is unemployed, somebody who earns just a little money, they cannot afford to buy food. And if they cannot afford to buy good nutritional food, they cannot make their own choices. They only get what is available to them. That will affect their mental health, just like you said in the that will affect their physical health, and that will affect a lot. If they have kids, it will affect the health of the kids, which will affect the education of the child also. And some of the kids ended up acting out. It's because they don't have good nutrition to help their brain develop like other normal kids. And just like you said too, it's a collaborative effort of individuals and community. If we can all just stop the stigma and come together as a community when there's a fair, and if parents also can try to inform their kids about, not stigmatizing low income family children, because that's another thing you see a lot. You see a child who doesn't come, the kids, how the kids are, they compare their food. Oh, my food is better than yours. You just eat bread every day. If the parents can understand this and help educate, give their kids a little information that, food insecurity, it's not a disease, it's not a problem. It's just that they cannot afford that yet. You can share your food with them or try to steer them to get better food rather than make fun of the kids at school. And all the other agencies can collaborate together and help. And just like the food bank, they've been helping. They've been holding food drives to help with the food pantries, but it's not enough. With the rising cost of food, even the middle class now are struggling themselves. It's just that most of the middle class people, they still cannot find themselves coming in because of, just with the stigma we discussed earlier about, somebody who is self-sufficient, they will feel they have low self-esteem and they really are not informed about most of the programs that are available. And because in some communities they don't equally have most of this program, they only have very one or two of the program, like the SNAP program. It's not enough, because with the increase of food prices, there's more people now. They have more people who are applying for this. For the housing, housing help too, it's not enough. There's a long list of people that they cannot even afford to meet half of the number of those people. So it is a problem that we all and most of the agencies, if they can just collaborate together and work together, maybe that will help a little bit and put out the word. Information, they say it's power. Knowledge is it's golden. If people are aware of these resources and they know they can freely go get find those resources without the stigma, without the labeling, then they'll be more open. And if they understand better, they'll be more open to go seek resources when they need it, and they won't have to wait. Then another thing is the cultural differences, because in some culture, the minority culture who are coming in from other countries and not from the US, they are not used to. They see that as, they because they don't understand how the system work, and because in their culture, they believe if you seek help, you're weak, you're lazy, and it's not always that way.
And that's another interesting conversation, just the internalized sense that if you do ask for help, that is a sign of weakness. And the other thing that you said that I really latched onto is you mentioned children in school and others making fun of them and the bullying that goes on and that entire cycle that goes into forming the mindset of the youth where they do feel diminished because they do start comparing themselves to others. I mean, they don't have the skills, the development to see that it's situational. They think, this is going to be my life forever. And I do think that is affecting so many other aspects, including suicide ideation amongst the youth. That is such a big issue, which again, it's a compound issue. It's not just the food insecurity, it's the bullying that comes along with it because of the stigma. So it's definitely something that needs to be addressed. There's just so many components. This is such a complex problem, Noel, that I am
It
so
is.
glad we are having this conversation because it is not top of mind for so many people that have never faced food insecurities. I wanted to ask you a question, or actually kind of put things into context. So, you actually happen to work in a food pantry that is adjacent to a very wealthy resort community. It's a ski town where it's known globally. Individuals come year round to ski because it is a mecca. And so, what we really have here is such a disparity that there are the very, very ultra well to do millionaires. And then we have the blue collar workers that are servicing those resorts. And that's kind of irony that in such a affluent community, there is such heightened sense of food insecurity and poverty. The wages are not matching what it costs to actually live in a resort community. This is a essential workforce, and the basic needs of that workforce is not being met, correct?
Correct.
Yeah.
And that's another big issue. That's why I don't want to dive into political stuff, but that's why I'll just limit it to advocacy. It boils down to advocacy. If we have agencies and organizations who can advocate on behalf of the low income people, they can let this result and the billionaires and the millionaires know that, oh, people are still hungry in your community, in maybe the next two neighbor from you, somebody who works for them, somebody who is working for you. They may not be able to speak out because you are their employee, to tell you, look, what you're paying us, it's not enough. We don't have enough food to eat. So they can only go to the food bank, which is why the agencies are the ones to advocate on behalf of those people and tell them this. There are people in your community, even if you cannot increase their salary, can you donate food to the food bank so that those people, where they feel comfortable to go, they can go there and still get alternative food to eat. And for those people too, another thing, which is why I keep saying that it boils down to advocacy, because everything is when they are well informed, both the low income earners and the corporation, about those people. Some of the corporation, yeah, they are aware, they are well aware of it, but some of them are not aware, or some of them are just feigning ignorance that things like that don't exist. And that's why if we have those advocacy people advocating for them, and we have the media equally advocating and highlighting these things, they can go to the food bank and see what's going there and report about this and talk about that. And for the corporation, I always tell them, if you feel there's no food insecurity in your community, just take 10 minutes or 15 minutes, go to a nearby food bank and just sit there and watch, or just go help them, just go do community service for 30 minutes and see what goes on in there. Then you understand better that you know the food insecurity is there, it's real, and it's increasing. And until we all collaborate and start doing find we all collaborate to find solution to this, it will keep rising as the price of goods go.
Noel, you said two things that I think bear repeating. The first is you mentioned that they're not aware they're there, that if they play blind to it, it's I don't see it, I don't see it, it doesn't exist. I think there is so much of that people just don't want to see because if they acknowledge the problem, then it puts on that
burden.
ownership, responsibility that, okay, this is something to be solved. So they would rather not acknowledge that the problem even exists. And something else that you said is I actually met you because I did get involved in volunteering and also working through a university system to just spend time in the pantry. Also because I'm Spanish speaking and there was a lot of Spanish speaking individuals that needed someone to communicate their needs. But individuals who are not aware that this is going on, this is your call to action. Go volunteer. Go
Right.
volunteer, get involved in a food bank. Don't wait till Christmas or Thanksgiving. That's not the only time when food insecurities happen, but really make yourself aware of how other people are hurting. Because your involvement, your volunteering may be the change that is needed just to change the stigma and the perceptions of what the situation really is. So, is there anything else that I did not know to ask you about food insecurity, Noel?
No, I think you did a great job, and just like you said, to just please and please get involved in your community, get involved with the food bank, try to find out the programs that are going on, to help the low income people. They are right there in your backyard. They are right there in your corner. You only don't see them. A lot of them cannot speak for themselves because a lot of them feel ashamed. A lot of them feel stigmatized. A lot of them feel, how will they look at me? I don't want to look like a beggar, because they believe that's what they are to those people. If you get involved with your community activities, and for the donations too, please, and just like you say, not just for during Christmas and during Thanksgiving, people need food every day, just like we all need to eat three times regular meal. Some people, they don't even have that one meal. If you can get involved and somebody gets one meal a day, that will equally go a long way. One good quality meal, that will go a long way to help the families, the parents, with their job, the kids at school, and that will equally help the community and the economy of our great nation.
Thank you, Noel. What a great way to end this chat. Thank you for being here with us today, and thank you, audience, for another episode on Your Health is Your Greatest Wealth. Hello, this is Blanca Luna Ainsworth. Thank you for joining me on today's episode. And if you haven't already subscribed to Your Health is Your Greatest Wealth, can you do that now? Just hit the subscribe button below. And also, please share. What I also wanted to let you know is that this is not just a YouTube channel, it is a movement. The whole goal is to help you improve your own health. Thank you.